This recorded review will be going over the study guide for Med-Surg 1, Exam 4. Chapter 12, the respiratory system. What is the action of mucus? We can see this on page 256. The mucous membrane secretes mucus. This traps dust particles and bacteria. Which patients can benefit from pursed lip breathing? We can see this on page 269. Exhaling through pursed lips is a clue to obstructive disorders. Patients with emphysema should practice pursed lip breathing. Describe the relationship between pH and respirations. We can see this on page 258. The signals of changing levels of hydrogen ions measured by pH, carbon dioxide, and oxygen will trigger the respiratory center to send signals through the spinal cord and spinal nerves to the peripheral nervous system and then to the phrenic and intercostal nerves that help control the diaphragm and respiratory muscles. Which way does the diaphragm move during inhalation? We can also see this on page 258. Inspiration or inhalation and expiration or exhalation will occur by the movement of the diaphragm and the intercostal muscles in the chest wall. When the diaphragm contracts, it moves downward and the other chest muscles contract, pulling the rib cage up and out, expanding the lungs and creating an area of negative pressure. Air from the atmosphere, which has a positive pressure, will then flow into the lungs. So the diaphragm moves downward during inhalation. And that continues on to page 263. What does surfactant do? Also going to be on page 263. Surfactant is secreted by cells in the alveoli. It decreases surface tension on the alveolar wall so that the diffusion of oxygen and carbon dioxide can take place. What is the major transportation system for oxygen throughout the body, and how is it carried? We can also see this on page 263. The major portion of oxygen, about 97%, attaches to the heme portion of the hemoglobin molecule carried by the erythrocytes, and it forms oxyhemoglobin. The plasma also transports a portion of each gas, and about 3% of oxygen is dissolved within the plasma. Which respiratory diseases are considered obstructive? For this one, we're going to look on page 265 in the table 12.2 pulmonary disease classifications. Notice that asthma, COPD, bronchiectasis, obstructive sleep apnea, chronic bronchitis, emphysema, cystic fibrosis, and ARDS are all classified as obstructive disorders. What is the relationship between smoking, alcohol, and throat cancer? We can see this on page 268 in the red older adult care points box. When assessing an older patient, it is important to obtain a thorough smoking history and a history of alcohol intake throughout adulthood. Approximately 90% of throat cancer will occur in people who smoke and immoderately drink alcohol, and it is 4 times more common among men. If the nurse auscultates crackles, what should the next action be? We can see this on page 270. It's in the text as well as the purple clinical cues box. Another type of coarse or sonorous wheezing sound, also known as rhonchi, is a coarse, low-pitched rattling sounds that caused by secretions in the larger air passages. Crackles are produced by air passing through moisture in the smaller airways. If crackles are heard, have the patient take a deep breath and cough. Listen again. If the crackles are no longer present, the atelectasis has been cleared. Where would the nurse expect to hear bronchovesicular breath sounds? We can also see that on page 270, within table 12.5, normal lung sounds. Bronchovesicular breath sounds can be heard over the main stem bronchi, below the level of the clavicles, beside the sternum, and posteriorly between the scapula. When is deep tracheal suctioning indicated, and how long for the nurse suction for each pass? We can see this on page 273. Deep tracheal suctioning, whether through the nose, mouth, or ET tube, should only be performed using strict aseptic technique and by someone experienced in the correct procedure. Suction passes should not exceed 10 to 15 seconds. Know your normal values of pH, oxygen, and CO2. That one's not a question, just a statement. How is respiratory failure diagnosed? We can see this on page 274 within the bolded text. Respiratory failure is defined by an arterial blood gas. It has an arterial oxygen, a PaO2, below 50, and the partial pressure of carbon dioxide, or PCO2, will be equal or greater to 50. Cardiac arrest can result from respiratory failure due to hypoxia and acid-base changes. Why is mouth care so important for the respiratory system, and when should it be implemented? We can see this on page 273 within the bolded text. Frequent mouth care will help remove pathogenic microorganisms from the oral cavity and thereby diminish the possibility that they will be aspirated deep into the air passages. Patients should receive mouth care after suctioning. How does edema affect the respiratory system? We can see this on page 263. When interstitial edema occurs in the lung tissue, the alveolar membrane is thickened and gases cannot diffuse across the membrane as easily. If fluid fills the alveoli, gases cannot diffuse across the membrane. Edema in the lungs will occur with infectious processes, such as pneumonia, and in disorders like congestive heart failure. How do age-related changes affect the respiratory system? We can also see this on page 263. Aging results in a decreased cough reflex and an increased potential for aspiration. Osteoporosis can cause kyphosis. This will impinge on lung expansion. Total body water will decrease to 50% after 70 years. Therefore, mucus and respiratory membranes are not as moist, and the mucus becomes much thicker. Muscle atrophy can affect the respiratory muscles, diminishing their strength. According to the CDC, which population should be vaccinated for influenza and pneumonia? We can see this on page 265. For certain groups, such as older adults and the chronically ill, immunization against influenza and pneumonia is an effective means of reducing the incidence of respiratory disease. Healthcare providers, nurses, and others involved in providing healthcare should also be immunized. On 263, we can see the definition of kyphosis. Kyphosis is the inward curvature and collapse of the spine. It constricts the thoracic cavity and restricts the capacity of the lungs to fully expand. On page 272 within table 12.6, look at the problem statement, anxiousness due to hypoxia and dyspnea. Nursing interventions for this scenario would be allowing the patient to verbalize their concerns within their ability to speak, but without becoming dyspneic. Encourage the use of pursed lip and diaphragmatic breathing to decrease dyspnea. Teach the best positions to decrease dyspnea. teach relaxation techniques, and encourage the patient to practice them. Interact with the patient with a calm, reassuring manner, and refer them to community support groups. We always assess the patient first. So before you do any interventions, we first assess. Chapter 13, Care of Patients with Disorders of the Upper Respiratory System. What is the contagion period of a cold? We can see this on page 279. A person with a cold is contagious for about 3 days after symptoms first appear. When would antibiotics be indicated for a cold? We can see this on page 281. A bacterial infection, which requires medical treatment, is likely present when a cold persists for more than 7 to 10 days without improvement, or if the patient begins to feel worse, has a temperature of 101, and develops chest pains or coughs up purulent sputum. Describe signs and symptoms of sinusitis. We can also see this on page 281. As exudate accumulates in the sinuses, pressure builds up, causing pain. Symptoms include tenderness over the sinuses, purulent drainage from the nose, nasal obstruction, and sometimes a non-productive cough. The upper teeth can also feel painful. Why are patients with obstructive sleep apnea fatigued during the day? We can see this on page 285. Daytime symptoms include fatigue, morning headaches, and difficulty concentrating. Physical examination of patients with OSA would typically reveal obesity, an enlarged neck circumference, and hypertension. Patients with sleep apnea will often wake frequently throughout the night, which can leave them feeling fatigued during the day. A patient is post-op from a tonsillectomy and clears his throat frequently. How should the nurse proceed? We can also see this on page 285. The patient should be observed for frequent swallowing postoperatively, and this could indicate a posterior nasal bleed. We can also see more about this on page 283. Vital signs should be checked frequently, and the patient is observed for frequent swallowing or clearing of the throat. This can indicate bleeding. Restlessness can be another clue to excessive bleeding. The postoperative diet should consist of cold or warm liquids, progressing to semi-solid foods for the first 24 hours. Avoid red foods to be able to distinguish between ingested food and blood. Citrus fruits, hot fluids, and rough foods should be avoided until the throat has completely healed. Straws should not be used because sucking can cause bleeding. Note that the stools might be black due to swallowing of the blood. So the nurse in this situation should have the patient open their mouth and assess for bleeding if they notice the patient clearing their throat frequently. What could indicate a posterior nosebleed after a rhinoplasty? So that's actually going to be on page 285, the same sentence that I read before. You would observe the patient for frequent swallowing. What is the purpose of a one-way valve in a tracheostomy? We can see this on page 288. A one-way tracheostomy valve box can be fitted into the tube opening. It will allow air to be inhaled through the tracheostomy opening, but the valve closes when the patient exhales. This will divert the exhaled air through the larynx and enable them to speak. What is the priority need for patients after they undergo a laryngectomy? We can see this on page 291. The laryngectomy patient will need to be provided with a means of communication, such as a pad and pencil, a dry erase board, a picture board device, or electronic devices with appropriate software. So we need to address the patient's communication needs first. That is a priority. How can patients status post laryngectomy warm the air they exhale? We can also see this on page 291. To protect the patient from inhalation of extremely cold air, they can wear a small scarf over their opening during winter. A stoma cover can also be used to retain moisture. How would you teach a patient esophageal speech? We can also see this on page 291. Many people can learn esophageal speech. First, they master the art of swallowing air and then moving it forcibly back up through the esophagus. Then they learn to coordinate lip and tongue movements with the sound produced by the air passing over the vibrating folds of the esophagus. The sounds might be somewhat hoarse, but it's more natural than those produced by an artificial larynx. Should the nurse deflate the cuff of the cuff tracheostomy tube prior to suctioning to reduce the risk of aspiration? Yes, absolutely, and we can see this on page 288. A cuff tracheostomy tube has a small balloon encircling its tracheal end. When the balloon is inflated, it will fill the space between the outside of the tracheostomy tube and the trachea, thereby providing a seal and preventing the escape of air around the tube. When positive pressure mechanical ventilation is administered, the air passes through the tracheostomy tube only, thereby providing sufficient pressure to inflate the lungs. So you would deflate the cuff tracheostomy tube prior to suctioning to prevent aspiration. How should the nurse clean a double cannula tracheostomy tube? We can also see this on page 288. In a double cannula tracheostomy tube, the outer cannula acts as a sleeve for the inner cannula, which can be removed for cleaning. The obturator or insertion guide is used during insertion as a guide to protect against scraping the sides of the trachea with sharp edges of the tube. The inner cannula should be cleaned with a pipe cleaner. You might remember that from our skill that we did. When epistaxis occurs, what should the patient be instructed to do to stop the flow of blood? We can see this on page 281. When epistaxis occurs, the patient should sit forward and apply direct pressure by pinching the nose just below the bone, close to the face, for 10 to 15 minutes. Define obturator. So I did that with my last bullet point. And again, if you want to look at that definition, it will be on page 288. What dietary restrictions are placed on the patient post-op from a tonsillectomy? So I kind of read that one already as well. And you can read over that again on page 283. It starts out with the post-operative diet. Chapter 14, Care of Patients with Disorders of the Lower Respiratory System. When are antibiotics indicated in acute bronchitis? We can see this on page 296. Antibiotics are used if a sputum culture identifies specific bacterial organisms. When are antibiotics indicated in influenza? What is a complication that could develop from influenza? We can see this on page 296. Seasonal flu. Antibiotics are given on page 296. Antibiotics are given only if there is evidence of bacterial infection secondary to the viral infection. If a person is known to be at a high risk of influenza or has been exposed to type, oh no, that's going to be a further bullet point. So antibiotics are given only if there's evidence of bacterial infection secondary to a viral infection. And bacterial pneumonia is a potential complication of influenza, page 296. What is the purpose of amantadine or Simitril? So that's going to be on page 296 as well. If a person is known to be at high risk for influenza and has been exposed to type A influenza, the healthcare provider may choose to provide prophylaxis with an antiviral agent, such as amantadine or Simitril, Ramantadine, zanamivir, or Tamiflu. These drugs must be started within 48 hours of the start of symptoms. Which patients are at risk of developing histoplasmosis? We can see this on page 299. Histoplasmosis occurs in central and eastern portions of North America. The fungus lives in moist soil, such as that which in mushrooms grow, on the floors of chicken houses and bat caves, and in bird droppings. So patients who come in contact with those types of things in the environment would be at risk of developing histoplasmosis. When can a patient discontinue pharmacological treatment for tuberculosis? We can see this on page 302. When 3 sputum cultures are negative and the clinician evaluates the effectiveness of the treatment, the patient is then considered no longer infectious and can resume work and other usual social activities. So 3 negative sputum cultures. When would the nurse know the TB skin test is positive in a patient with low risk? So we can see this on page 300. The test is positive when the swelling at the injection site is more than 5 millimeters in diameter 48 to 72 hours after injection in patients with a history of contact of infectious TB or immunocompromised. In duration of more than 10 millimeters in diameter is considered positive in recent immigrants from countries where TB is prevalent, in medically underserved groups, and the homeless. For patients at low risk, the induration of more than 15 millimeters is considered positive. What is the action of montelukast singular? We can see this on page 309 within table 14.4. Montelukast or singular provides both bronchodilation and anti-inflammatory effects. Should the suction be bubbling in a chest tube? We can see this on page 318. When the unit is attached to wall suction, there will be bubbling in the compartment. The level of fluid determines the amount of suction applied to the chest. The middle chamber is the water seal chamber that prevents air from entering the chest cavity, and titling should occur in this chamber. So that answered both bullet points. So should the suction be bubbling? Yes, it should be bubbling when it is connected to suction. And how should the water level look in a chest tube? It should be titling, which means movement with breathing. So you would expect to see movement in the water seal chamber as the patient is breathing, and that would be a normal finding. You are caring for an immediate post-op thoracotomy patient who has not had any drainage in the chest tube for 4 hours. What is your next action? So we can actually see this on page 319. It's in the think critically box, and you would check the tubing for kinks. How should postural drainage be scheduled? We can see this on page 323. Because there is likely to be some gagging during coughing episodes that take place during postural drainage, it is best to carry out the procedure before meals, when the stomach is relatively empty and vomiting is less likely. If the patient is to have postural drainage only once a day, drainage should be done in the morning to remove secretions that have accumulated throughout the night. After postural drainage is complete, good mouth care, including brushing the teeth and using a refreshing mouthwash, must be performed. What is the purpose of continuous positive airway pressure ventilation? We can see this on page 327. CPAP and bilevel positive airway pressure, or BiPAP, can be used for patients who are breathing spontaneously but showing signs of hypoxemia. CPAP and BiPAP are not delivered through an artificial airway. Therefore, they are considered non-invasive positive pressure ventilation. In the home setting, NPPV is used in the form of CPAP or BiPAP, primarily for sleep apnea. The delivery devices will use room air, not oxygen, for the gas delivery. The primary function is to keep positive pressure in the airway to prevent it from closing during sleep. So that one continues on to page 328. Which type of pneumonia is associated with HIV and AIDS? We can see this on page 298. Pneumocystis jirovecii, also referred to as PCP, infection associated with AIDS is treated with Bactrim given IV or orally depending on the severity of the infection. So PCP pneumonia or pneumocystis jirovecii pneumonia is associated with HIV and AIDS. How should a patient be instructed to use a peak flow meter? We can see this on page 310 within the blue patient teaching box. To properly use a peak flow meter, instruct the patient to put the mouthpiece in the mouth and clamp the lips firmly around it for a tight seal. How can influenza spread? We can see this on page 296. Seasonal flu is spread by direct and indirect contact with infected people, by coughing and sneezing, and by the virus being transferred from contaminated hands to objects. It is extremely virulent, and it usually affects young adults first, and then will spread to the very young and very old within the community. The damaged tissue in influenza will provide an environment for the growth of bacteria that can lead to a secondary infection, which is most commonly bacterial pneumonia. What education can be given to a patient with tuberculosis? So we can see this on page 302. Patients and families should be educated about the importance of medication compliance and the basic principles of infection control, including covering the mouth when coughing or sneezing, disposing of tissues in plastic bags, practicing good hand hygiene, and wearing a mask when in contact with crowds until the medication effectively suppresses the infection. Sputum examinations are required monthly during treatment. Also on page 301, take a look at the treatment of active TB. It consists of taking at least 4 drugs for an extended period of time. These drugs are given in varying combinations and on varying numbers of days in the week. The treatment protocol outlines an initial 2-month phase, then followed by several options for the continuation phase of either 4 or 7 months. Drug combinations that make compliance easier for patients are available. This would include rifamate, which includes rifampin and isoniazid, and rifator, which contains rifampin, isoniazid, and pyrazinamide. Chapter 8. Drugs for allergy and respiratory problems. This is in the Introduction to Clinical Pharmacology textbook. Describe the action of an antihistamine. We can see this on page 115. An antihistamine is a drug that stops histamines from attaching to histamine receptors on cells and producing inflammatory and allergic symptoms. Why should patients with glaucoma exercise caution when taking antihistamines? We can see this on page 118. A rising intraocular pressure in patients with glaucoma could worsen the disease and could cause blindness. List expected side effects of antihistamines. We can see this on page 118. Patients should expect a dry mouth, increased heart rate, increased blood pressure, dilated pupils, and urinary retention to occur because of the anticholinergic effect of antihistamines. How do decongestants work? Do they decrease inflammation? We can see this on page 119. A decongestant is a drug that reduces the swelling of the nasal passages. It doesn't reduce it reduces the allergy symptoms, but it does not reduce the actual inflammation. So decongestants reduce allergy symptoms, but they do not reduce inflammation. What is a common side effect of inhaled medications? So we can see this on page 125 within table 8.4. You should teach patients about the expected side effects of a stuffy nose, sore throat, and constipation because not knowing the side effects will help relieve their anxiety when they appear. Which patients should exercise caution when taking leukotriene inhibitors? We can see this on page 119. Although adverse reactions to the leukotriene inhibitors are rare, liver dysfunction is possible with long-term use. The leukotriene inhibitors will interact with drugs that stimulate liver metabolism, such as phenytoin, phenobarbital, carbamazepine, and rifampin. Montelukast has the least number of drug interactions. What should asthma patients always carry with them? We can see this on page 124. It'll be in the top tip for safety purple box. Teach patients with asthma to always have their SABA reliever drug with them at all times because an attack can occur anywhere and only a SABA will work fast enough to prevent a severe attack and death. What infection can result from the use of fluticasone or Flonase? We can see this on page 120 within table 8.2. Fluticasone or Flonase. Nursing implications include telling patients to watch for white patches in the nose or throat. These could indicate a fungal infection because these drugs will reduce the local immune response. Why aren't LABAs helpful during an acute asthma attack? We can see this on page 124. Some beta-2 adrenergic agonists are long-acting drugs. Although they work in the same way as SABAs, they tend to take time to build up an effect, and their effect will last longer. A long-acting beta-2 adrenergic agonist, or LABA, is an orally inhaled drug that binds over time to beta-2 adrenergic receptors and is used as an asthma controller drug. So they just take a bit too long to work. That's why they're not helpful during an acute asthma attack. They are long-acting, whereas the SABAs are short-acting. They will provide immediate relief. Can children take mucolytics? At what age? We can see this on page 128 within the green lifespan considerations box. The FDA recommends that these products not be given to children younger than 2 years old, and some products shouldn't be given to children younger than 6 because of cases of overdosage. So after the age of 6. How should patients be instructed to take a mucolytic? We can also see this on page 128. In addition to drug therapy, teach patients to drink more fluid each day and breathe humidified air to help thin secretions. Suggest that they take the mucolytic with a full glass of water. List side effects of antitussive agents. We can see this on page 130. Common side effects of antitussives include drowsiness, dry mouth, nausea, and postural hypotension. Antitussives that contain codeine are also likely to cause constipation. When using a SABA and a corticosteroid, what should be used first? So we'll go back to page 124, and it'll be in the orange memory jogger box. When using a SABA and an inhaled corticosteroid together, always use the SABA first. SABA first. What are some nursing implications when administering antihistamines? We can see this on page 117 within table 8.1. You should warn patients not to drive or operate hazardous equipment because these drugs will cause drowsiness. Warn patients not to take these drugs with sedatives, opioids, anticholinergic drugs, or drugs that cause CNS depression because the CNS side effects will be more severe. Warn patients and families to observe for any changes in behavior or mood because all of these drugs can cause these problems in some patients. List side effects of inhaled beta-2 adrenergic agonist. We can see this on page 124. Common side effects include hypertension, tachycardia, headache, and insomnia. Some people feel nervous, and they may have tremors with these drugs. Dry mouth and a bad taste are common effects. Cardiovascular side effects are more noticeable with the SABAs because the onset of action is so rapid. List side effects of Atrovent. We can see this on page 125 within table 8.4. Teach patients about the expected side effects of stuffy nose, sore throat, and constipation because knowing the side effects will help relieve their anxiety when they appear.